Restorative treatment of the malpositioned dentition is presented by Dr. Antonio Mancuso and is supported by SciCan, makers and distributors of high-performance products for dental professionals.
And we're back 2 weeks later. Jerry's been in temporaries for approximately 2 weeks now, and today's session will be the insertion appointment. We're going to be using rubber dam to isolate Jerry's anterior area with an anterior trough technique. I'll be illustrating that, and then we'll be removing the temporaries and trying in the porcelain restorations one by one, and then concomitantly all together prior to inserting the restorations one by one. Now the restorations have been pre-inspected. All cases should be pre-inspected prior to having your patient seated and anesthetized. You want to check for the length of your centrals, make sure they're exactly what you've asked for. You want to check to see that the contours and the proper surface texture has been provided by your ceramist, etc., etc. Jerry, all ready?
All set.
So Jerry, I'm going to put some clamps around your back teeth, okay? It'll be fairly tight for a couple of minutes. Just give me a second to get this positioned for you. And to seal the palatal area, we just use some bite registration and put it against the palatal aspect of the rubber dam, and just gently put it under the wings of the clamps to give a little bit of mechanical locking. Okay, now we're prepared to remove the temporaries. Now typically you can try to tease off the temporaries, but if you have any real serious mechanical interlocking interproximally, then what you may have to do is with a carbide burr just go interproximally and make your slices, and then pop off the temporaries by using the end of a scaler to actually crack the bisacril methacrylate. Excellent. Okay, let's use a little chlorhexidine, wash everything off. Now we're just going to clean the surfaces of the teeth with, say, chlorhexidine. And we have that's it. Now in the 2-1 area, last time we did some laser gingivectomy, and you can see that the tissue has healed very, very nicely. However, there are a couple areas where it's still fairly erythematous, and those are areas that potentially, once you apply your phosphoric acid, may tend to start to bleed. So prior to applying phosphoric acid, we're going to use some Expasil, a material from Kerr. And I like to apply it just as a preventative measure in that area or any other areas that you feel you may have a little bit of hemorrhaging when you apply your phosphoric acid etch. And we'll leave it on for approximately a minute, and now we'll wash it. All right, now we're going to be trying in the restorations. Over here. And Jackie will be holding them for me. And typically I like to start with the two centrals. And one of the things I want to do at this point is ascertain if there's any movement when they are fully seated. And if there is, if I alter the path of the insertion, will also create movement. I want to assess whether I have to put in the 1-1 first or the 2-1 based on how the ceramist has layered his porcelain interproximally. Good. After I've ascertained that the 1-1 and 2-1 sit to my expectations, then I'll remove the 2-1. And I'll do the same thing between the 1-1 and the 1-2. And there I feel that it's binding just a little bit. So if I could have a 1 disc. So I'm going to make a small adjustment to the contact area on the distal of the 1-1. And I'm just using a 3M coarse disc. Okay. There we go. And same thing, I'll be removing the 1-1 and putting in the 1-3 now. Good. Bless you.
Thank you.
And then the 1-3. And the 1-4. Good. And in like fashion, I go the other side and do the same thing. And I basically do a 2x2 check. Come pliers. This is the benefits of having a nicely sealed palette. You can easily retrieve your restorations. I'm satisfied with that, and now I'm going to put all the restorations in place at one time, and by doing that you will again see if there's any displacement of any of the restorations and if you have to alter that contact surface. Thank you. Now there is one area that I'm not satisfied with, and that is between the 1-1 and 2-1. There's a little bit of displacement there, so I'm just going to remove all the restorations and adjust that prior to doing a final try-in with try-in gel. After making the necessary adjustment, don't forget to polish the surface that you've abraded. And in this case, I use a Dialite porcelain system. And you go through your gradation. Of points so that you end up with a nice glossy surface. Cute. And we're using just a transparent Trian gel, and in this case it's the Variolink Trian gel from Ivoclar. And all you need is just a dab in the center of the restoration. And we're going to just remove any excess. At this point, we're going to be asking for patient approval prior to proceeding with the final cementation of the restorations. It would be prudent, if you have any concerns about the actual patient themselves wanting to have a real good look at the restorations, to remove the rubber dam, seat the patient up, have them look, accept the restorations, and then reapply the rubber dam and continue. I'm very confident with Jerry. Jerry and I have talked already. I know exactly what his expectations are. So I'm just going to have Jerry look at the restorations in this position with a large facial mirror. Jerry, just take a look. See, I'll remove these for you, Jerry. You can take a look. Gives you an idea of the final restorations. What do you think? Wonderful. I knew you would. All right, so what I'm going to do now is just clean them all off and one by one cement them in place for you. Okay. Now, in a normal day when I do these type of cases, I would have an extra auxiliary, another assistant here, who would take the restorations and go to another operatory. There she would remove the Trian gel, clean the Trian gel from the internal aspects of the restorations. She would apply a phosphoric acid to cleanse the restorations, then silane for approximately a minute, lightly dry the silane, apply the adhesive, the bonding agent, to the internal aspects of the restorations, and then apply the base only of your adhesive system or your cement system, in this case Variolink, to the internal aspects, and then put them in a light protected box. She then would return into the operatory with that scenario. In today's situation, Jackie will be doing all that, and while Jackie is doing that, I will be cleansing and sterilizing the surfaces of Jerry's teeth. Again, we'll be using an antibacterial agent, chlorhexidine, to clean the teeth, and then I will apply a desensitizer. In this scenario, it will be Super Seal. After copious layers of Super Seal, then we will apply our bonding agent, light cure that on the teeth, and then one by one apply the restorations. Okay. And just give me the chlorhexidine. Thank you. We can see that 2-1 where the laser gingivectomy was done, even with the attempt of Expasil, still looks a little touchy, and I'm afraid that once I apply the phosphoric acid that it will start to bleed. So as a safety mechanism, or as a further assurance, I'm going to apply hemostatic agent. If I can get some trichlor. And what I apply is trichloroacetic acid. It's an agent that will immediately blanch the tissue. It's a self-limiting process, but it will assure me that the area will not bleed once I apply the phosphoric acid. And we're just going to lightly wash this. Okay, Jackie? Good. Excellent. Now, when applying the phosphoric acid, you don't want to over etch. So what I will do is etch the anterior 6. And a little suction. And then I'll do the other two, okay, Jackie? Just suction right on the lingual. And then I'll etch the premolars. Okay. Now let's dry this off, and then I'll replace those cotton rolls, okay? And we're going to be replacing the rolls underneath to get a little bit better isolation. And at this point I will apply my super seal. Super seal acts as not another wetting agent, but also as a desensitizer. Now, if you're going to dry this, just again very, very lightly. Okay. Teeth have all been bonded. We're going to light cure. And you'll have some tissue as well, for the flossing. And again, it's imperative that you start with the 1-1 and 2-1. Oh, we got the other way around. Okay, and rubber tip. And I like a rubber tip to remove the excess. Again, typically I have 6-handed dentistry when I do these restorations. Today we're using 4, so you bear with us. And what I will do now is tack the restorations. And I use a small 2mm tip, and I go right at this cervical area. Approximately 7 or so seconds, and then you run your floss in proximal. When you run your floss, go from the labial and pull palatally. Have your assistant with some tissue to remove the excess, and then go on the distal surface, and then the distal surface. When I do this, I always hold the incisors at the incisal edge, and I'm holding the floss apically with my left index finger and pulling straight palatally. Okay, now we're going to go with the next two. And cover that, please. Again, rubber tip. Remove as much of the excess as possible. We'll minimize cleanup afterwards. Again, we're going to tack at the cervical area. Seven seconds. And then running the floss in same fashion. Very good. And typically at this point, I let my dental assistants do the final cure on all the restorations using conventional halogen light with one assistant on the lingual or labial, and then the argon laser for the other surface, so that all the restorations are cured. So today I will do that.